So today I chose to talk about the lungs, um, because I think it's one of the most essential organs in your body. So I'm going to go over their structure, what they do, and how a disease like pneumonia can affect them. So by the end of the presentation, I'll just really go into how air moves through our lungs and why this is so critical. So right here, I have a picture of the lungs, and they're two soft, spongy organs inside your thoracic cavity, and they're responsible for helping us breathe. They're part of our respiratory system, which brings oxygen into our body, and it removes carbon dioxide, which is a waste gas that our body naturally needs to get rid of. So as you can see, each lung is built, kind of like a pyramid. The right lung is larger and it has three lobes. So it has a superior, a middle, and an inferior lobe. The left lung only has two lobes. It has an inferior lobe, a superior lobe, and an inferior lobe. Um, and this is because it also has a notch in it, which the cardiac notch, which makes room for our heart. Um, the right lung also has two fissures. So it's going to have an oblique fissure, but it's also going to have a horizontal fissure, while your left lobe is or left lung is going to have only an oblique fissure, and that oblique fissure is going to separate the superior lobe from the inferior lobe, while on the right lung, the horizontal fissure is above the oblique fissure, and that is to separate all three lobes. So, air travels from our nasal or oral cavities down the trachea, and it's going to split into two main bronchi that you can see here. Um, to look further into it, here's another diagram. So the primary bronchi branches into a secondary lobular bronchiole. Um, and then excuse me, the primary bronchi branches into secondary lobar bronchi. And then there's one for each lobe. That is what I meant to say. But these split into tertiary segmental bronchi, which you can see right here, terminal bronchioles. Um, and then these will branch into even smaller bronchioles that we can see here that are respiratory bronchioles. And then this will lead us to our alveoli. So these tiny airways are going to lead us to our alveolar ducts. These will end in alveoli, and that is where the main site of gas exchange is really going to occur. In the terminal bronchioles here, this is the end of our conducting zone, and then the respiratory bronchioles is going to be the start of the respiratory zone where gas exchange will occur in the alveoli. So, as I said before, at the ends of the bronchioles are millions of alveoli, which are these tiny balloon-like, right here, these sacs. And they're surrounded by capillaries, which we can see in this diagram here. They have thin walls, which is really important because if the walls are thin, gases can pass in and out easily. So oxygen is going to enter into our bloodstream, and CO2, or carbon dioxide, is going to move out because we're going to exhale this. And this process is done by simple diffusion, and it really is what keeps us alive. And it happens every breath that we take. So, some other structures to note that support our lungs are first the diaphragm, and this is the main muscle for breathing. It sits inferior to your lungs, and it's going to contract to pull air into our lungs, and it's going to relax to push it out. And then the lungs are also protected or surrounded by a protective membrane, and that's going to be called our pleura. And the pleura really reduces friction as they expand and contract inside our thoracic cavity. Another thing to note about lungs is they do a lot more than just, push air through our bodies. They help regulate our blood's pH by controlling carbon dioxide levels. They filter out small blood clots. They filter out air bubbles. They're actually responsible because they enable us to speak by controlling the airflow through our vocal cords. Something that I notice is in a lot of movies or TV shows when someone is choking, they can't speak. So that's something that I just connected to the lungs through this chapter. And they also help you smell because they allow air to reach your olfactory receptors. So a disease I wanted to look at when it comes to the lungs is pneumonia, actually. And this disease is going to affect our alveoli, which you can kind of see here. There's normal, and then this is going to be what happens when you have pneumonia. So pneumonia is caused by like pathogens, viruses, fungi, all that bad bacteria. And when you're infected, your alveoli will go from this normal looking alveoli here to this. And what is filled with, it's filled with fluid or pus. And this makes it hard for oxygen to get through those thin walls to go into your blood, which is a really, really dangerous thing to happen for us because oxygen is extremely important and vital for us to live. Now, some other symptoms that comes with this is a wet cough with mucus, fever and chills, shortness of breath, and then chest pain is also a big symptom, especially when someone is breathing very deeply. And then people with weak immune systems, such as like children, infants, or the elderly, or those who might have a chronic illness, they're going to be at greater risk for severe complications, especially if you have another disease, such as asthma, or a chronic illness like asthma. That's going to be a really big risk factor. So when the alveoli are filled with this fluid and they're inflamed, your gas exchange slows down. So less oxygen is going to go into your blood, and your body tissues become basically oxygen starved. And I bet anyone can tell how dangerous that would be. So this can lead to fatigue, dizziness, and confusion, and is very, very dangerous. So overall, your lungs work around the clock to bring in that oxygen and to remove that carbon dioxide, but they also keep every cell in your body alive, especially from your trachea down to those tiny alveoli. Every single step is such a vital role. So when something like pneumonia comes in and disrupts a small part of our system, the effects can be very serious, and in some cases, they can be life threatening. So that's why it's really important to keep our lungs healthy. So avoiding smoking, staying active, getting vaccinated, anything we can do to promote our lung health is really, really crucial. So thank you.